Many of the patients who come here to my clinic ask me why it is that diabetics get worse and worse and worse under care. And actually, sometimes when they first come in, they realize that that's what's been going on with them. But once they've attended our lecture and see that that's what goes on with virtually all the diabetics in the class, their question to me is, why do diabetics get worse and worse and worse under care? And there's three possible answers to that. The first one is that diabetes is a progressive disease, and of course they're going to get worse under care. The second is that they're not treating the cause of the problem, and that's why people get worse under care. And the third is that the treatment actually makes people get worse. So before I get into the answer on that, let me say something. I had a woman working with me a few years ago who did help in my physical therapy area for our patients. And she had been a drug buyer for the largest Northern California HMO. And she said to me, it's a well-known secret within the drug buyers group that more than 90% of people who start on oral medication end up on insulin or insulin mixtures. Now that was what she told me. That's not what I said. That's what she told me. And she said it's not well known with the patients, but that the doctors actually expect the patients to slowly get worse and worse and worse under care. So that's also what I've seen since I've been doing this seminar. We've done this seminar for close to 5,000 people at this point, and most of them also are in agreement that that's how their diabetes progresses. So why is that? Is it because diabetes is a progressive disease? Well, I don't think that's the reason, because I've worked with people who've been diabetic 1 year, 2 years, 5 years, but I've treated a number of people who've been diabetic for as long as 40 years, and some of them on 10, 12, 13, even 15 medications, and usually within a few months we have their blood sugar back into a range where they don't need medication or insulin anymore. So if diabetes was a progressive disease and you of course needed constantly to increase your medication, then how is it that with a few gentle lifestyle changes, sugar goes back into a normal range? So I don't think that's the case. Now the next question is, are we treating just the symptoms and not the cause? And I would say that's pretty true. We're not getting to the cause of the problem. There's a preponderance of research right now. If you read the medical literature on diabetes, there's an awful lot of research telling us that there's some underlying causes to diabetes that are not being addressed in treatment. We go into this heavily in the seminar that we do in our clinic, and I'd really like to invite you to that seminar because we cover this in great detail in the seminar. Now, the last reason that is often thought or questioned as to why diabetics get worse and worse under care is it possible that the treatment is actually making them worse? So diabetes medicines definitely lower people's blood sugar levels. But over time, their levels start to go up and up and up again so that they need even more medication. One theory is that these medicines are toxic, and by constantly increasing the toxic levels in people's bodies, they slowly get sicker and sicker and sicker. So is it possible that that may be causing diabetics to get worse as well? And again, in our seminar, we go into this in great detail. But I will tell you that all three of those reasons, the idea that diabetes is a progressive disease, the idea that we're not getting at the cause, and the idea that the medication may actually make people worse, helped us to come up with a program that slowly turns the situation around and helps people to get well. Now, many patients come to me also. One of the big questions I get is, why am I becoming resistant to medication or resistant to the insulin? And the truth for me is, I don't believe you get resistant to the medication or resistant to the insulin. I believe that even while you're taking those medicines, your situation is slowly worsening, and that's why over time you need more and more and more medicine. it isn't that the medicines aren't working, it's that your body's getting sicker and sicker and sicker under care. And that's a terrible thing. Most of the patients we work with get to the point where they need less and less and less medication to manage their condition. And that's really what treatment should accomplish. So I hope this was helpful for you today. We'll talk about diabetes more in upcoming vlogs. And we're also going to talk about a few other conditions like fibromyalgia, like stroke recovery, and a number of others that respond beautifully to this type of care. So that's all I have for today.